Hi everyone and welcome to my channel. I'm Yana, one of the registered nurses here in Queensland. In today's video we're going to be going back kind of to educational style videos that I used to do for you guys before. One of my subscribers asked me to highlight a topic in regards of following policies and procedures and also standards for practice for registered nurses. So she wanted to know what as nurses we have to follow, what we actually by law obligated to follow, and yeah, talk about it more in details. So I have bullet points here written in my notebook that I will be referring to so that I won't forget anything. Let's start first from the ones that are more general for everyone, including even midwives and also enrolled nurses. So that is your standards for practice. They do have them on APRA website, also Queensland Health website. So if you go there, you will find them separated into different PDF files for registered nurses, for midwives, and also for enrolled nursing. So standards for practice is quite a lengthy document, and it's about using your critical thinking, and not just using it but also developing it with the years of practice, because the more you practice, the more your critical thinking becomes stronger and better. So using that, then also be respectful to your patients and also to your colleagues. Also about teamwork, about continuous learning, which is in nursing is so important, because once you step into this career, you will be always learning something new, and this is what this field wants from you as well, to always do this continuous learning, because in healthcare we always have something new coming up. There are new changes happening, new improvements as well happening, so you need to, as a nurse, always catch up. And if you feel like you need to learn something, you know, you can always enroll yourself to additional learning modules or trainings that your NAM on the work can approve for you. So the options are there for you. You just need to pretty much take a step and accept it. And then as well about providing quality care to your patients. The second one that we need to follow is a code of conduct. So this one is about professional behavior and also about promoting well-being and health information to your patients. So professional behavior could be not just to the patients but also to your colleagues, because as nurses we work not just with nurses but also with doctors, physios, dietitians, speech pathologists, wound nurses, allied health professionals as well. There are so many different multidisciplinary team members in this profession that you will need to deal with. So you need to display professional behavior in terms of respect, clear communication, listening, and also finding the balance when you are discussing what's best for your patient, because everyone would have their own opinion, but you need to share this information with each other and then find the best approach for the patient. Then the third thing is a code of ethics. So this one is about as well finding the balance when you making decisions for the well-being of your patient. Here could be as well useful to add in discharge planning nurses as well, because they are responsible for discharging patients and also working on appointing for them maybe relevant services when they go home if they need more help, maybe community some sort of help or services as well. So you as a nurse, when you talk to your patient, and if they let's say tell you certain concerns about fears of going home because they won't be able to look after themselves in a better way, you need to collaborate together with the treating team, with the discharge nurse, a social worker, to find the best way for the patient to be safe at home, so that, let's say, they won't have falls and not to come back again to us, or not to forget to take their medications, and of course would as a result become worse, deteriorate, and come back again to the hospital. So all of that would be in a code of ethics. So pretty much finding that balance when you're making decisions for your patients, and not just for the discharge but also when your patient is still at the hospital as well, during the treatment options and care plans. So it's a good way to find balance there too. Then following up with the mandatory yearly trainings. So as registered nurses and also enrolled nurses, every year we have different trainings that are coming up on our TMS system. that we have to do. For example, your blood administration products training, you need to upgrade it all the time. Your first aid and CPR, your basic life support training, your manual handling. We also have different you know, how to call it, items and ways coming up every year for manual handling. There are different hovering mats, there are different mobility aids, like new styles of Serra-Steady, different and more approved hoists to move the patients. We do also have like different sizes and different textures of the sliding sheets, and also different techniques how you can pull out the sheet from underneath the patient in a better, safer way, so you don't hurt yourself or the patient, so with less discomfort. So every time the physios and in general allied health professionals work on every year improving the manual handling, they would put it there to TMS modules, and you will go and in person do the training to get yourself familiarized with those new techniques that coming up. Because we have so many different people working in healthcare field. Everyone have their own different thinking, you know, some are more creative than the others, so those ones can come up with more ideas, you know, and then those ideas are taken into considerations, and then new policies and procedures are made. So therefore you need to every year upgrade yourself and update those trainings, you know, and repeat them. I know sometimes it feels overwhelming, because when you work as a nurse, your roster can be so hectic. You most of the time will be working as a shift worker, and catching up with those modules and trainings can be quite hard actually. But this is one of the requirements that we have to do, and if you don't do it, your NAM will chase you for that and ask you to do it, because there is no way around it except doing it. You can't just leave it, because if you don't do it, I haven't heard that the people will be fired from the work from not doing it, but I also haven't heard anyone that would say no and purposely not to do it. Like, everyone eventually do it, even if you're late. You can talk to your NAM and just like explain why you were late, and then catch up slowly on it. Then the first aid and CPR training, you can either do it through the hospital or you can do it separately. There are different companies, like third-party companies, that have nothing to do with Queensland Health. They run those courses in a separate cost, and you can book yourself in and do it. And then that money cost for that course you can actually claim through your tax return. So you will pay it at that time when you need to pay for the course, but then this money will be returned to you through the tax return. Then the other one, which is important, is disposal of handovers before going home. So remember, the handovers that you have at the hospital, it's a written paper with mostly like information about your patient. It's date of their birth, it's their full name, it's the history, medical history, it's diagnosis, it's presenting diagnosis as well. It's the treatment options that are happening right now, and the plan as well. So there are a lot of details written on a handover about pretty much all patients in the ward where you work. So before you go home, you're not allowed to bring with you home a handover print out sheet. You have to dispose it, and at the hospital on my ward we have special disposable bins where you put the handovers and nobody can take it out. It's like, you know, when you go to vote, it has that box with a little bit of opening there, and you like slide in the pieces of paper, and then like once it's in, nobody can access it. So this is similar to that. And then disposal of the handovers and any other documentations that are no longer needed in a paper form will be disposed in the right way. So you're not supposed to take those ones with you home. Then another one, which is kind of like linked to this one because it's all about privacy, it's a social media and also mentioning and talking about patients in public places. So be careful, do not share on your social media, and by social media I mean all the platforms where you have profiles, your personal profiles about your colleagues or about your patients. You can talk about, like I talk, for example, about nursing in general, you know, and what it's like for me to work as a nurse, what I have to do as a nurse, but I never mention names of my patients or which hospital I'm working in. I do not mention names of my colleagues as well. So I might talk, for example, about diagnosis of my patients for the purposes of learning and sharing with you guys, so you know what you may come across when you become a registered nurse. Treatment options I might talk about, but try not to talk on social media about your bad day and what has the patient done, you know, if the code black was used, you know. Try not to talk about things like that, because even if you do not mention the name of the patient, but you're talking about certain situation which is in a negative kind of way, if anyone come across your profile, if anyone will come across your text or post, they may link it to that situation that you're talking about. If that would be a friend of that patient, or someone who knows that patient, or someone who even works with you. Okay, there are good people there and there are bad people there. You know, some people can be jealous or envy, and even though you didn't use any names of the patient, they still may report you. So just be very careful when it comes to social media. And the second aspect of it, in a public places, I've noticed that, and we were warned about it as well when I used to be a nursing student, but later now when I started working as a nurse, I've noticed this myself in person. Sometimes after the work, after the shift is ended, you know, on one level or even multiple levels at the hospital, everyone jumps to the lift, and you will hear nurses talking about something negative about their day to day. They might not mention the name of the patient, but they may mention the number of the bed. And if it happens that in a lift someone might be standing there who maybe know that patient, you know, or maybe it's a relative as well, and they've heard you talking negatively or just complaining how hard your shift was about that patient, that could take you in big trouble. Because there is something about, you know, like just the ethics, about respect, you know. Even if your day was bad, even if the patient behaved really bad and disrespectful towards you and the staff, and like it was a disaster, do not talk about it in public places, because lift of the hospital, elevator is a public place, stairs is a public place, hallways outside of your ward is a public place. So just be careful, do not discuss these things with your colleagues outside there in open places like that, because sometimes even if you're standing in a hallway, it could be that you're talking in a nursing station, you know, like facing with your back to the nursing station, like the hallway side, talking about the patient with someone, and one of the relatives or friends of that patient may just come up to the admin area asking you know, something about the patient, or maybe it's the friend of the patient who hasn't come yet to visit that patient yet and coming first time, might be just coming in to ask which bed the patient in and hearing you talking. Okay, so just be very, very careful. So you need to be very respectful and ethical in that sense, even if you had a crappy day and the patient was behaving really bad. Another one is APRA registration. Every year we have to renew our APRA registration as a nurse. Yes, it has to be every single year. And I think now it's like $200 or something like that. The price is slowly going up. You can claim this money from the tax return as well, but you need to renew your regi every year. So pretty much when you're already working as a nurse, you just fill in the form on official APRA website. You don't have to supply anymore all your ID documentations and things like that, because it's been already done from the beginning when you apply for it a first time, when you graduate as a student and you're ready to receive your license. But then year to year, if you already started working as a registered nurse, all what you need to do is just refill the form online and just click on submit and pay, and your regi will be renewed. I think from what I remember, I think it's every time in May or April, and you will have 1 month to renew it. So this is mandatory, you have to do it. Okay, then we nurses follow hospital policies and procedures. Here it would differ from hospital to hospital, because private hospitals procedures are a little bit different to the public ones that belong to Queensland Health. So you will find there a little bit of a difference. But in general, for example, I will give you small examples. Yesterday I had one of my patients had an ascitic drain inserted. So ascites is accumulation of fluid in an abdomen cavity that could be linked to heart problems, liver problems, alcohol consumption, unsafe medication consumptions or drugs. Like it could be different reasons for that. So once you start to have this big fluid accumulation in your stomach, in your abdomen cavity, it will start to compress the organs. It may even like push and apply pressure to your diaphragm. I'll try to put for you here a picture so you could imagine how it looks like on a person who has a lot of water there. The person might feel fatigued and short of breath, because can you imagine carrying all that liters of fluid in your abdomen? So they would come to the hospital and we will drain it by inserting ascitic drain into abdomen cavity, and we will drain a certain amount of fluid to ease that person's life. Until then, they will find different ways on how to act and work on the causes of it. If it's a heart, they will work on a heart, you know, and things like that. So the policy in my hospital is when someone comes with the drain, you have to do 15 hours OBS, 15 minutes OBS for half an hour, then half an hour OBS for 1 hour, and then 1 hour OBS for 4 hours, and then the person goes on 4 hourly OBS. And you need to monitor the dressing, you need to monitor how many liters of fluid coming out. There is a procedure which I'm not going to go into details here. So there is a policy for it that you have to follow. So every time you see that 15 minutes finished, you have to do another set of OBS and document it in a system. When you, for example, give iron as well, there is a policy and procedure that you need to follow, and it will be printed out and sent it to the ward in a box together with the iron itself. So you as a nurse, you can just take the print out and follow it, literally like read it and follow it when you administer iron to your patient. Another policies and procedures would be, for example, double check when you do your S8s and S4s. So you need to find another nurse to check it with you. The policies would be as well any injections, any intramuscular injection, subcut injection, intramuscular injections, any IVs need to be checked by 2 people. I know that in aged care now they're stepping away from double checks of S4s, which is crazy in my opinion. But at Queensland Health, we still need a double check of S4. So just follow policies and procedures of your hospital, because this is something that would be applicable just for that particular place of your work. And since you are employer of that place, you have to follow it. Then talking about medication, you need to follow safe medication administration practices. So that would be following your 6 rights: the right patient, the right route, the right order, valid order, the signature from the health professional who has ordered it, that would be your doctor, and the date. So date and something else, I can't remember all 6 of them. So you have to follow all of them there. And then also you need to do a double nurse check if it's a S4 or S8 or any type of injection or IV administration. You need to do a double check. And also you need to know what you're given. Actually, this is a must for nurses to know what type of medication is it that they are given to the patient. If you don't know what you're given, look on an indication, because if it's a paper chart, the order for the medication has at the bottom indication section, and in the indication section usually the doctors write what the medication is used for that particular patient, because some medications can be used for different causes, different reasons. So it will be written for that particular patient what this medication is used for. If the team is busy and they haven't written the indication of the medication, you can also bring the chart to the pharmacist, and the pharmacist will write it in with a purple pen. Usually the pharmacists, they would be going through the folders of the patients. I'm talking about the paper-based system in the hospitals that are not on IMR yet. The pharmacists, they will be going through the folders, a certain amount of folders throughout their shift every day, and just checking all the orders and writing in the indication, checking how many days the person has been on particular medication, because sometimes doctors forget, and the person might be longer than 4 or 5 days on thiamine IV before going to oral. Sometimes they stay longer on IV medications, which should be already maybe finishing in 5 days. So sometimes, because the teams are so busy, those things can happen. They're not often happening, but can happen. So the pharmacist and us as nurses, we're kind of like a backup. We are backup to check on those mistakes. So yeah, so the pharmacist can fix it up for you. If the pharmacist is busy and you really need to know that particular moment, open up the MIMS. Every medication room, or we call drug room, has MIMS in there. It's a blue book. Open it up and have a look so you know what medications you give, because it's for your safety to know what you give, because some medications can affect vital signs, can affect blood pressure, heart rate, respiratory status as well. So you need to know what you give, okay? And you need to do your vital signs before you give it as well. And you know what? You don't want to put yourself in a position when your patient asks you what tablet that is and you don't know, because like you will look incompetent, and you don't want to put yourself in that position. You know what I mean? Okay, the next one is ongoing professional development, which is CPD points. So as nurses, we need to do 20 points a year, and that could be any learning. Okay, you can book additional TMS trainings. So in Queensland Health, we have TMS system where you can access different types of trainings for different topics. Okay, they could be online trainings, it could be in-person trainings. All what you need to do is apply for it, wait for your approval from the NAM, and you go for it. Last year I went to 5 different trainings. It was diabetes, cardio, respiratory. I went to how to detect deteriorating patients and what to do when you see someone deteriorating, and 5th one, I can't remember what was the 5th one. Anyway, those ones were 8 hours trainings, so they were like your working day, and they were all paid. So my NAM has approved all of them in different months of the year, and they were all paid. They were more than 20 points, but I enjoy going to workshops because I can learn something new, I can refresh my mind as well, and sometimes it's just good for a change to go and just sit and learn, you know. So yeah, I love it. Makes me feel like professionally special and professionally bigger, more important, I guess. You know, it gives you that confidence, extra confidence when you go and you learn something new. Okay, then the other one that we have to follow is wearing the uniform to work. This is a big one. You can't come to work if you're a registered nurse working on a floor, on a ward, wearing a dress or like smart casual. You have to wear scrubs, and every nurse division or type has different color of scrubs. For example, AANs in Queensland Health, they wear teal color. ENs, royal blue. Then RNs now, it's midnight blue, it's more darker. Then doctors, they wear green. But doctors can come in normal clothes as well. But usually residents, the young, you know, interns, they wear green. Then pharmacists, they wear purple, okay? Physios, they wear royal blue, but it's like polo shirts, it's not scrubs. But pharmacists and doctors and nurses, we all wear scrubs. Physio, allied health, they wear, you know, blue color, but more like a polo shirts, and it says like physio, so you know it's physio. Then dietitians, they come in black. Your registrars and your what's the other doctor, registrar and consultant, they wear black and gray scrubs, or they might come in normal clothes. Okay, so everyone except doctors, because they can wear anything they want pretty much, everyone else need to wear a specific uniform. Okay, this is how patients can define who is who, and it's easier for them and it's not very confusing. Your uniform has to be relevant to your position. So if you're a RN, you have to wear scrubs for RN. The Queensland Health is not really particular on wearing only Queensland Health scrubs. You can also wear different brands scrubs as long as you wear your color. If you want to wear a different color like pink, orange, except purple or green, do not wear those two. You can buy them from different brands. You can find funky scrubs from Gorman and Dangerfield, and you can wear them on Friday, which is a fun scrub day, or you can wear them on a weekends. Okay, so yeah, but the uniform is essential. You have to always wear your uniform. Then next one, you have to demonstrate effective teamwork and leadership. This is must. You need to practice and work as a team player on each of your shift, because nursing is a teamwork. Every nurse on a ward, we have a ratio of patients. Every ward is different. Where I work in a general medicine ward, it's 4 patients per 1 nurse, and I work in pairs. I will have another nurse working with me, so they will have their 4, I will have my 4, but we work as a team. I help them, they help me. We do cross checks of S8s and S4 medications. We help each other to do cares to the patients. We also help each other if we need to, for example, if she needs to go down or he needs to go down to escort the patient to the imaging, then I will be looking after their room while they're downstairs. And then also on a ward, we work as a team, always. If you see that someone has a heavier load today, the patients are more heavier than yours, and you finished your medication rounds and all the cares and everything that you needed to do for the patient, and you literally have free time now, go around your ward and offer help, because we're trying to always create balance on a ward. And this is the best practice, this is the best teamwork, because you don't want to be in a position when you happen to have a heavy load and nobody will come to help you. Therefore, teamwork is a must for us nurses to follow. And also leadership. You need to be able to organize your day in a way that if you, let's say, need help, or if you need to delegate the cares to EN or to AN, use that leadership skills, and also leadership skills between the nurses that you work with. If you are a TL on a shift, that's the best way to practice your leadership skills, because you will be leading the whole ward. If you're working as a CN, would be the same thing. So this is essential as well. Then another one, remember, you need and must to practice only in your scope of practice. Okay, don't pretend to be a doctor. Do not try to talk to your patients in a lot of details about treatment options, or discuss something that the doctors may be querying about the patient in a notes. Leave that to doctors. Do not do things that you're not supposed to do as a nurse. You're probably wondering, how do I know that this is my scope of practice and certain things are not in my scope of practice? For example, if someone has a chest drain, right? Someone has fluid in a pleural cavity, and the patient went down, they had the chest drain inserted. So in your scope of practice is to monitor the swinging, the bubbling, the dressing of the chest drain, how much has been drained, and just the general well-being of the person while of the patient while they having that chest drain, and document the output, document all your observations in regards of that chest drain. Okay, that's your scope of practice. What is not your scope of practice is trying to let's say clamp the chest drain while the doctor's told you not to, pull it out, you know, or use a suction while the suction was not ordered. What else? Yeah, do anything with that drain that may displace it or disturb the work of the drain itself. The same example would be, similar example would be to ascitic drains. For example, yesterday my patient, the order for the ascitic drain was to drain 10 liters of fluid or 6 hours, to keep it unclamped for 6 hours, whichever comes first. And it's strictly said, do not clamp it unless the patient starts rapidly drain up to 4 liters in 1 hour. So in my scope of practice, okay, I know that if the doctor said to me not to clamp it unless this and this, I would not clamp it, okay, because I'm not a doctor to change the order. My scope of practice tells me as a nurse to follow directions and the orders from the treating team. Okay, if I was a doctor, then yes, my scope of practice would be different. I would clamp, unclamp, whatever is, whatever is needed to be done according to my understanding and my scope of practice as a physician, when I'm treating that patient. But I'm a nurse, so I follow direction of the doctor. Okay, so you need to act in your scope of practice and not to get out of it, because you might put yourself in danger. You might put your patient in danger, and you don't want that to happen, and then you will be responsible for it, and talk to the management. So that is important. Following values of your place of work. For example, I work for Queensland Health, and our values are compassion, teamwork, excellence, respect, integrity, care, and in some cases use your imagination and creativity. So respect, for example, a small example of respect, different backgrounds, different cultures, different religions. Okay, respect all your patients because they all come from different areas of the world, of different cultures, different beliefs. So just respect and listen to them, and do not apply any pressure just because their way of thinking or their way of life is different to yours. Compassion, as nurses we need to provide, of course, and practice compassion to our patients because they come in a vulnerable state, and we need to understand that. Teamwork, I have talked already about. Excellence, always strive to be better in what you do and always learn new things. Integrity, be honest and open. Care, provide the best care you can. And imagination, as I said, just use your creativity sometimes, especially with I've noticed this, like as nurses we use our creativity when it comes to patients with dementia, because we still want best for them. We want them to eat, we want to shower them, we want to provide the best care we can for them, but sometimes they can behave a bit naughty because they have dementia, and they would refuse you to feed them, refuse you to shower them, refuse you to change them, or even sometimes take medication, and that person needs the medication because they have heart problems or diabetes or whatever. So you need to be here a little bit like cheeky and creative to find the ways. It's like nearly dealing with children, to make them take medication, to make them have a shower so that like they won't have UTIs, and actually have a proper wash and be clean, because a lot of them are incontinent, so you need to change that pad sometimes. So you kind of like start to use a little bit of creativity, how you can help the patient, in a good way, but still kind of get your way to keep them safe and healthy. So those are the things that came into my mind according to my practice that I wanted to mention in this video, guys. Those are the things that we follow as nurses. There are more things there that I probably forgot, and also depending, as I said, of where you work, you will have different policies and procedures and also protocols to follow. So I would advise you, if you come across a certain procedure that you are not 100% sure about what to do during the procedure and post, or even prior, you can always ask more experienced nurses or CEMs, which means your clinical nurses on a ward, to guide you and help you to print out from the Queensland Health website the policies and procedures that then you can follow for that particular procedure. It's very easy. It's very, very easy. Just always ask. There are heaps of materials online for us nurses to use and follow. Pretty much every procedure or every protocol has written somewhere instructions online that you can download. So yeah, those are the things that I wanted to mention. If you have anything to add or if you have more questions, please feel free to ask them in the comments below. Thank you for staying on my channel. If you do like the information that I provide, please subscribe and like this video because it does help my channel to push my videos to more audience. And till then, I will see you in my next videos.